I'm Alice. This is for my English class, 2089. If you just want to say your name real quick.
I'm Jane Massengale. I am a nurse on A7 Central and also the education specialist for complex pulmonary and endocrinology and complex airway.
Wow, that's incredible. So I'm going to start out with my first question then.
Okay.
My first question is, in college, what made you want to study nursing?
I decided before college that I wanted to do nursing. That I was actually a patient here at Children's. When I was 2, I broke my leg and had to be hospitalized for it because it broke my femur pretty bad. And ever since then, I always just knew I always wanted to work here. But even like in kindergarten, you had to draw a picture of what you wanted to be, and I drew that I wanted to be a nurse at Children's.
That's incredible.
So, well before college.
Yeah? And is that what led you to want to become a pediatric nurse specifically?
Mm-hmm.
All right. My next question for you would be, when you graduated, what kind of hospitals did you apply to, and were majority of them pediatric hospitals?
So when I graduated, the market was saturated with nurses. Like there just weren't jobs available here at Children's. They could be picky. They could hire the more experienced people. And so I worked here as a PCA, but actually left and worked over at UC for a year because they always had openings.
Yeah.
And then got notified that there was a position open back up at Children's, and as soon as I found that out, I came back.
Wow. That's very different to today, where there's a bunch of openings.
Oh yeah, I mean now there are open jobs everywhere. You pretty much can pick wherever you want to go.
Absolutely. Was there any specific training that you had to go through to become a nurse, other than your bachelor's degree?
So here at Children's, we do something like that. It's called RNO, which is Registered Nurse Orientation. And that's where they go over a lot of the specific things that you'll do here at Children's and kind of the pediatric approach to things. So we did that. And then like in school, as part of our like tuition, we paid for a Pearson Review course where you had to, it was like you graduated on, May 5th or whatever. And then literally the very next week, you had to go back to school. And it was a 5-day course where they went over kind of NCLEX testing questions and styles. It was really terrible because it's like you were so excited that you graduated, but then you really didn't.
Right.
You had to go back to school pretty much right away, but the test, that helped prepare everybody for the test.
There you go.
Yeah, so it was worth it.
A real teaser. Would you say that NCLEX is okay to take, or is it nerve-wracking?
It's nerve-wracking, definitely. You got to do the practice questions. I know that's annoying when you're in school because it's the last thing you want to do, but I feel like that helped me more than anything else. And I would definitely recommend for when you finally take when you go to take your boards, to take at least one test where it has I think now you guys do 175 questions as the max. Back when I did it, it was 265.
Wow.
So I did one test 2 days before where it was all 265 questions, just so you could kind of mentally prepare for this is how long it might take. And usually they've got certain apps you can use where it'll have a test counter or whatever where it tells you how many questions you answered, how long each one took, which ones you did well on versus not so well.
Wow.
But then I would recommend the day before you test, don't study, just like take a day to relax. Don't do anything too crazy, but maybe just laze around, watch some TV. Don't sit there and cram and study all day long because I feel like that just adds to the stress and pressure.
Absolutely. All right. What does a typical day in the life of a nurse at a pediatric hospital look like for you?
Okay. So I don't do so much bedside anymore. I'm in charge a lot, but typically a bedside nurse would get report first thing in the morning. You come in and your assignment's there with the phone that you'll use. You get report on the patient, you look over the orders, and then you start your day with getting your vitals and assessment done, go pull all your medications. And so this is a complex pulmonary and endocrinology floor. So a lot of times you'll be checking blood sugars or hanging antibiotics or giving insulin. So even if your patient doesn't have any of those issues, you're usually buddying up with somebody where you go in and witness their insulin or stuff like that. But it kind of has peaks and valleys as to where it's busy versus not busy. Right now it's not so bad, but there are some days that you're just busy all day long and you don't get a chance to hardly sit down.
Right.
So after you get all your meds in, usually it's time to start doing your noon assessments, and kind of some more medications. And then we just do them at 8 a.m., noon, and 4. So a lot of times you're kind of coordinating things between them, whether it's dressing changes or going for pulmonary function tests or doing lab draws. A lot of times you're getting admissions and stuff like that too.
Wow, yeah, busy.
Yep.
If you were to pick a random memory that's either good, funny, whatever, a positive memory, what would you say that memory would be for you? Working with family or a child?
Well, I have a picture on my desk back here of a patient that we used to have, and I've taken care of her since she was about 5.
Oh.
She's 15 now.
Wow.
She had just moved to the United States from Kuwait, and I've known her for so long. She has diabetes and pulmonary issues, and so I've kind of seen her on both sides of it.
Wow.
And she had been living in the hospital for like 8 or 9 months, and I had her a lot just because of the fact that I've known her for so long, and she was very, very critical. And there was one day I went in her room, and she said, "I have to tell you something, but don't think I'm weird." I was like, whatever. And she said, "Last night you were in my room checking my blood sugar, and you scared me because, like, she was asleep, and we'll do it when people are sleeping because I don't want to wake them up every 3 hours."
Right.
And she's like, "But you put my finger, but I knew it was okay because I could smell that it was you." And I evidently I've got this perfume that she loves that she went and had her mom go buy a bottle of it because she loved it so much. And she's like, I knew it was you, so I knew I was safe. And so that made me feel good that she still thinks that.
That's
after
adorable.
all these years.
Do you still see her today?
Oh yeah, she was here not too long ago.
Oh wow, that's incredible. And what would you say the pros and cons are of working with kids rather than adults? And is there something like that makes it unique?
Kids are resilient. There are adults that come in with problems that may not survive certain things, but kids, they bounce back, and they bounce back quickly. A lot of times, it's kind of a hard thing to answer, but there's so many differences. In adult care, some of the things that happen are their choice, whether it's bad decisions or lifestyles that they kind of create their situation. And kids, like, they're innocent.
Yeah.
And in adult care we treat them the same too, but in kids it's just, I feel like you have a little bit more compassion, and you need to help them because they can't do it themselves. They didn't do this to themselves.
I agree 100%. In pediatric nursing, did you ever experience any biased doctors that you think treated patients unfairly, or that you felt like you had to advocate more for that patient specifically because the doctor wasn't doing his or her job?
Not that I've seen. I know that we're looking into some studies with our diversity and equity and inclusion about how maybe not necessarily we treat them differently, but how certain populations are more prone to certain diseases or conditions based on their socioeconomic status. And so there's ongoing research, but I've not personally seen anybody willfully or even unintentionally treat anybody different based on race, religion, or identity.
That's awesome. Did you ever have a case where you had to advocate a specific treatment that you thought would be better compared to a different treatment that was being chosen for that child?
Oh yeah. It has nothing to do with anything, any bias, but
right.
We had a patient that they had a central line, and somebody had given meds that were not compatible, and so it caused the line to precipitate to where you can't flush it anymore. And some of the things you can do is to give sodium bicarb to break that up, because whatever was in the line caused an acid, so you give a base to try and break it up. And it's something that we don't do on the floor typically. The IV nurses, like the VAT team nurses, do it, and it's not like it's difficult, but at the same time, these are really important meds, and you don't want to screw them up.
Right.
And I didn't know much about it other than it's a dwell. It's something that should just go in the line and stay there. And the doctor had ordered something that was 50 milliliters, and I was like, okay, I know I'm not the expert on this, but that's not right.
Right.
I know this can't be right. And he says, no, I reached out to pharmacy, and this is what they said. And I was like, I don't think this can be the right dose. And so I called down to pharmacy, and it turns out that they ordered the wrong thing. they ordered the dose for a patient who was actively coding and was acidotic, not for a Lyme precipitate. So what he should have gotten was a half an ml.
Wow.
And what they ordered was 50 ml. So it was way more than the
Wow.
recommended dose. And it could have killed the patient.
Right.
So, and that's one thing I always tell people in orientation is like, if you think something's wrong, even if you don't know, you know, every single little detail, if it just in your gut seems wrong, always abdicate and reach out. Make sure everybody's on the same page and that it's safe before you have a chance to
Absolutely.
do that.
I bet you felt good after that one.
My heart was racing because I was like, I knew this wasn't right, but we had a float nurse that was like, oh, I'll just go give it. And thank God she didn't.
Wow, that's crazy. My next question would be, when working with families, have you had any negative experiences, and how would you handle them?
So working in peds, you do deal a lot with families. There's been some negative experiences throughout the years, and a lot of times it's from patients where like there's potential neglect, and you have to put your feelings aside, where you might really not want a parent to visit or not want them to be around because they have potentially caused harm to their child, but you really have to do what's best for the kid. And until there's documentation and proof that they've actually done something wrong, you got to treat them and you got to do everything exactly how you're supposed to.
Right. It's sad sometimes, isn't it?
Oh yeah, working in peds, I feel like you can definitely learn to hate people for some of the stuff that they've done.
It touches the heart.
Or the neglect or willful abuse.
Or if they happen to abandon their child in some form. It's just, whew, it's sad.
Yep.
What are some of the best things you have seen families do to help in the care of their child? How have parents stepped up?
And anytime they advocate for their child, because so these kids come in and we see them when they're sick, whereas the family's used to seeing them when they're healthy or when they're at their baseline at least. And so there are plenty of times that a kid may come in and it may be something small, but they've got underlying conditions, and we may just excuse it as, oh, you know, they're a former preemie, maybe that's why they do that, or maybe this is that. And the parents always say, no, you know, they never breathe this fast, there's something wrong. And a lot of times they're right, that they know their kid better than we know their kid. I may know the pathophysiology and the medications to treat things, but they're the expert on the kid.
Absolutely. So. That's well said. What are some of the best things you've seen families do? We already did that one, sorry. Yep. When it comes to being a nurse, how do you often interact with the kids so they don't see you as like a bad guy or someone that's just coming to poke them all the time?
You just try and get them on their level, and so sometimes it's distracting them with bubbles or pinwheels, or sometimes it's like, oh, you know, if we have this, we can do a popsicle, or we can try X, Y, or Z. But a lot of times it's a lot of the things we say to them or do to them, it's not like they have much of a choice in. We're doing it because they need it medically.
Right.
And so it's kind of getting them so that we're all on the same page. And with kids especially, you don't give them a choice of if they want to do something or if not. It's a choice of like, do you want to take your shower first, or do you want to go on a walk or whatever? It's not like, do you want to go on a walk today? Like there are certain things you have to do.
Right.
And we give them choices to maybe when they do it, but not necessarily if they do it.
Right.
Because everything we do here is to try and get people better.
Yes. In nursing, do you think that there is any drama between fellow nurses or coworkers, and are there any special bonds that you guys have that kind of?
I mean, there's always little bits of drama, I feel like, in any workplace, but I think right now we've got a really great group where we all support each other. Some people hang out socially outside of work, and you know, on the 27th I know that we're having a big diaper shower for 3 of the nurses because they're all expecting, so we have a good support system here.
Absolutely. And I think this is like my last question, but do you think you will always want to work with kids for your entire nursing career?
Yes. 100%.
You enjoy it, right?
Yes.
You never want to go to adults?
No. It's not that I want to work at children's because I don't want to work in adults. I want to work at children's because I like working with kids.
Oh, that's awesome. Do you have any other comments to make about pediatric nursing on this floor? Anything like that?
I highly recommend it, and if anybody ever wants to come to children's, we'll be happy to have you.
There you go. Thank you for your time, and
You're
thank you
welcome.
for doing this for me last minute.
Good luck with school.
Thank you.